Our previous video showed how to use the patient summary screen to enter much of the structured data that's required to demonstrate meaningful use. In this video, we'll discuss actions that are performed elsewhere in InteliDOX and give system administrators a quick rundown of system-wide features that can be used to support meaningful use. Please note that this video was recorded using a beta test version of the software, so the program may look slightly different at your practice. In our previous video, we demonstrated how to export the contents of a patient summary screen to a continuity of care record, or CCR file, that can be transmitted to another provider. InteliDOX can also import CCR files, as well as CCD, or continuity of care document, files that are received from other providers. If you receive a clinical summary file for one of your patients from another provider, please call BusyNet's tech support staff for help with importing the file into InteliDOX. CCR or CCD files are stored in a specially configured image corral and can be viewed and indexed the same way that you manage scanned image files. An optional but easy to satisfy meaningful use measure is allowing patients to access their basic clinical information in a timely way. InteliDOX meets that requirement using the Patient Portal, a secure website that ties into InteliDOX to let patients view their allergy list, active medication list, problem list, and some test results. Patients register themselves for the portal using identifying information like their first and last name, date of birth, and social security number. So long as the information they provide matches the information stored in InteliDOX, you don't have to do anything special to grant them access. But you'll see reports from the portal show up as messages in image corrals to let you know once a patient has registered. Another optional but easy measure is providing patient-specific educational resources. InteliDOX has had the option to configure patient information sheets for years, but if your system administrator hasn't set that up yet, now's the time. You select the information sheets that are appropriate for a patient using a specially configured iPaper form. The selected sheets are sent to the patient's queued patient printing list, where they can easily be printed as the patient checks out. Another meaningful use measure that's optional in this first stage of the incentive program is patient reminders. You can meet this measure by sending appropriate reminder messages to at least 20% of your patients who are age 65 or older, or 5 or younger. For example, you might want to remind your older patients to get their flu and pneumonia vaccinations, and/or send reminders to parents about their kids' immunization schedules. Your system administrator, with BusyNet's help, can set up templates with the appropriate wording for the reminder notices, and the new Clinical Search and Reminders report is used to actually generate the notices. The Clinical Search and Reminders report can also be used to generate all kinds of reports on the fly, based on demographic information like patient age and sex, problem descriptions, medications, allergies, and test results. To pass this meaningful use measure, you just need to run at least one report of patients with a specific condition, such as diabetes, arthritis, or whatever diagnoses are relevant to your practice. As I mentioned in our first video when I was talking about the medication section on the patient summary screen, you should now be e-prescribing whenever possible, instead of using the traditional prescription module. It's not necessary to create electronic prescriptions for vaccinations that are administered in the office, or for controlled substances, since you'll still have to print those, but you should try to use e-prescribing for everything else. If the patient's preferred pharmacy can't accept electronic prescriptions yet, that's okay. Our e-prescribing partner will automatically fax those prescriptions for you. Most pharmacies are set up to accept electronic prescriptions, though, and e-prescribing can be fast for you, especially after you've saved the meds you prescribe most often to your favorites list, fast for your patients, since the prescription may arrive at the pharmacy before they do, safer for your patients, since the e-prescribing system automatically checks for drug-to-drug and drug-to-allergy interactions, and possibly cheaper for them too, since insurance formulary information is automatically displayed whenever it's available. Information available through the e-prescribing network may also make it easier and more accurate to perform medication reconciliations for patients who have just transitioned into your practice. The PBM pharmacy history option may show some medications that you weren't aware of, and it's easy to add prescriptions from the previous drug history list to the patient's active medications list. Once you've reviewed the patient's meds list, click the Mark All Active Medications as Verified button. A core requirement of meaningful use is CPOE, or Computerized Physician Order Entry. In this first stage of meaningful use, CPOE applies only to the ordering of medications. The use of e-prescribing or the traditional InteliDOX prescription module by licensed personnel who can enter orders in the medical record per state, local, and professional guidelines should satisfy the CPOE requirement. Another core requirement is Clinical Decision Support, or CDS rules. InteliDOX currently has one CDS rule that's based on the patient's BMI, or body mass index. If the BMI is considered out of range based on the patient's age, the pop-up window that's displayed when you click on the To-Dos indicator will let you know, and will suggest procedure codes that can be posted on the patient summary screen to indicate that you've addressed the issue. Because some of the meaningful use requirements apply to a high percentage of your patients, for example, at least 80% of patients who have an appointment during the measurement period need to have at least one diagnosis code on their problem list, you should run the meaningful use calculations reports often, preferably every day. Just select a provider, then click the MU indicator at the bottom right corner of their picture. The first report you'll see includes patients who have an appointment scheduled for today, and lists each of the meaningful use measures. If a measure is highlighted in pink, that means this provider hasn't reached the required percentage for that measure based on today's appointments. You may be able to increase the percentage for the measure by clicking the View Missing Items link for the measure, clicking on the name of a patient shown on the list, then updating their chart with the required information, for example, updating their problem list. When you click the Finished button at the bottom of the list, the Meaningful Use Calculations report will be updated to reflect any changes you've made to patient charts. The View All Items link shows both patients who do and don't meet that measure. Measures for which the provider has reached the required percentage will be highlighted in green. Measures that are gray are those that aren't tied to specific patients, but require a particular feature to be tested at least once. The Meaningful Use Calculations report for today is helpful because it can help you identify patients from whom you may need to gather additional information, such as their preferred language or smoking status. You can also run the report for the reporting period you've chosen, which is 90 consecutive days in your first calendar year of participation in the incentive program and the full calendar year in consecutive years, or for a custom date range, which can be any length of time from a single day to a full year. For example, if the My Reporting Period report shows that you're way behind for the 90-day period that you want to report on, you could try running the Custom Date Range report for a different time frame to see if those numbers are better. This screen also includes a Quality Reporting tab that shows how your patient is doing on a number of clinical quality measures. For each quality measure that's available, the report shows the patient population, which is the number of your patients that the measure could potentially apply to, which is often based on the patient's age and existing diagnoses, the denominator, which may depend on some additional criteria to select patients, such as those who've had at least a certain number of office visits, the numerator, the number of patients to whom the appropriate care has been delivered, and exclusions, the number of patients who are excluded from the measure because a condition such as an allergy or other problem that makes the generally recommended care inadvisable. Although CMS doesn't currently require you to set any goals with regard to quality measures, you do have to report on at least 6 of them, even if you haven't met any of the measures. The first 3 measures on the list, adult weight screening and follow-up, hypertension blood pressure management, and preventive care and screening for tobacco use and cessation intervention, are suitable for practices that see mostly adult patients and check patients' vital signs. If none of your patients meet the conditions for one or more of these quality measures, for example, if your practice treats only patients under the age of 18, or measuring vital signs is considered irrelevant to your specialty, there are 3 alternative measures on which you can report: influenza vaccinations for patients age 50 or older, weight assessment and counseling for children and adolescents, and childhood immunization status. You must report on at least 3 of these 6 measures, even if you have to report that the measures don't apply to any of your patients. You must also report on at least 3 more clinical quality measures. You can choose whichever ones are most relevant to your practice. Again, you're not required at this stage to meet any particular goals with regard to clinical quality measures, other than reporting the numbers shown on this screen. But if you're interested in seeing what kind of data must be entered in InteliDOX to increase a measure's numerator, which is the number of patients who are receiving the recommended care, click the Help button for that measure. If you're a regular InteliDOX user, not someone who's in charge of managing the InteliDOX system, you can tune out now. The rest of this video is intended for system administrators and talks about how to configure user accounts and global settings to achieve meaningful use. Some meaningful use requirements apply to features that need to be turned on in InteliDOX or tested at least once. Some of the requirements are integrated into e-prescribing. If you're not already signed up for e-prescribing, you'll need to be to achieve meaningful use. When providers e-prescribe, features like drug-to-drug and drug-to-allergy interaction checking and drug formulary checking are automatically available. Whenever possible, lab test results need to be stored electronically in a structured format. Faxed lab reports, even those that are stored within a computer system, don't qualify. If you're not already using an HL7 interface that automatically retrieves results from labs, please contact us to discuss this. You'll need to perform at least one test of electronically submitting information to an immunization registry and/or a public health surveillance system. Immunization information is entered using InteliDOX's traditional prescription module. We'll help you set up vaccines on your medications list with the CVX codes and other information that immunization registries require. When a prescription is created for a medication that has a CVX code, InteliDOX will automatically create a file that's ready to be sent to an immunization registry, and we'll show you how to transmit those files as attachments to email messages. Public health surveillance reporting files are also created automatically for patients who have a scheduled appointment, a complete set of vitals with the same date as the appointment, and a diagnosis on the problem list that is associated with a Centers for Disease Control code and has an onset or diagnosed on date that matches the appointment date. When such a diagnosis is added to the patient's problem list and the summary screen is saved, a pop-up message will ask if the user wants to report electronically, and if that option is chosen, a file containing the reportable information will be created. We'll show you how to transmit that file as an email attachment. Security is a big part of meaningful use, but since InteliDOX has had many of the required features for years, the new requirements shouldn't be a big deal for you. To satisfy the audit log requirement, you can run the Security Audit Report. The Security Audit Report has been updated to include actions that would fall under the optional Accounting of Disclosures measure, like emailing, faxing, and exporting patient data. The emergency access requirement is satisfied by InteliDOX's patient blocking feature, which lets you restrict access to certain patient accounts, like VIPs or employees of the practice who are also patients. If you use patient blocking, we recommend that somebody in the practice be given the right to override blocking when necessary. So even if that employee wouldn't necessarily be allowed to view a certain patient's chart under normal circumstances, they can temporarily give themselves that right in an emergency. The automatic log-off requirement is satisfied by InteliDOX's screen blanking feature. Once the InteliDOX screen has blanked itself, users will need to enter a special 5-digit password or their regular InteliDOX password to get back into InteliDOX. You can set a default screen blanking interval for everybody on the global settings screen, and if necessary, you can adjust settings for individual users who need shorter or longer blanking intervals, using a special file on those users' workstations. InteliDOX has a new global option to zip and encrypt patient files that haven't been accessed in a given time period, such as 15 days. This supports the general encryption requirement. When a user views a chart that's been automatically compressed and encrypted, the files will be uncompressed and decrypted in a matter of seconds. Encrypting files that are being sent to another provider is done by entering an encryption password while exporting the patient summary screen to a continuity of care record, which was demonstrated in our first video. The requirement to ensure integrity of patient data is satisfied by InteliDOX's new ability to export continuity of care records, then calculate a SHA-1 hash value for the exported file. To calculate a hash value for a file, use the Calculate a SHA-1 File Hash button on the security screen. The resulting value can be copied and pasted and transmitted, for example by email, along with the CCR file. The recipient can generate their own hash value for the file they received and verify that it matches the hash value you sent them. You should already be creating unique InteliDOX user accounts for each of your users. This meets the access control requirement. The requirement to authenticate users who access the EHR is satisfied by requiring InteliDOX users to log in with a valid username and password. If you need help turning on, configuring, or using any of these features, please contact us.